everybody. Thank you so much for taking the time to be with us tonight. I, for one, am very excited about what we are going to learn tonight from Julie Allen-Rowland. Please could you turn your microphones off, and if you would like to put on the captions, press the CC button on the bottom of your screen. At the end, we will have time for questions and answers, so please could you wait until then to ask your question. We are also recording this webinar for later viewing. For those of you who don't know about Connectable Life is an online platform that offers mind, body, and wellness consultations in an easy, safe, and stigma-free environment using a secure built-in video call facility. How it works, a client would go onto Connectable Life, choose the category and subcategory, for example, body and the subcategory functional medicine, or wellness and the subcategory life coach. They would watch the different specialist videos, book a consultation with the chosen specialist, pay for the consultation, and then at the allotted time, they would have the consultation with their specialist within a built-in webcam on Connectable Life. No need to use any other medium or platform but Connectable Life. It is so simple and easy, safe and convenient, all in the privacy and safety of your own home, office, or space. All you need is a device and an internet connection. The reason behind Connectable Life, our goal is that we can make healthcare a norm for everyone and accessible to everyone. Our hope is to highlight the value of wellness over illness and that there is strength in reaching out for help. Healthy does not simply mean the absence of disease. Healthy means physical health, happiness, and peace. To be truly healthy and happy, you need to be intentional about looking after your mind, body, and wellness. We want to help normalize therapies of all forms. Now, for the reason we are here. Thank you so much, Jules, for joining us tonight and for sharing your incredible knowledge with us. A bit about Jules. So, Jules, has been in practice in the health industry for more than 25 years. She started off as a podiatrist and is therefore registered with the HPCSA. She completed a degree in psychology and communication. She is certified in health and nutrition from the UK. She is also certified in kinesiology and exercise science. She then moved into functional medicine. Functional medicine is a science-based discipline that addresses the interplay between your genetic inheritance, your functional cellular status, your nutrient status, the impact of stress and exercise, and how that relates to either addressing already established chronic disease or improve the risk of inheritable chronic disease. Functional medicine sees the body as a whole with interconnected parts. Jules has had patients all over the world and addresses conditions ranging from weight loss to depression to autoimmune disease. We have had so many wonderful questions tonight. Thank you. Unfortunately, Jules will not be able to address them all, but she will try and cover as many as possible. Tonight's webinar on the thyroid is the first of two webinars. Tonight, Jules will address how a healthy thyroid should work and how to address hypothyroidism. And the next webinar will be specific to the autoimmune condition Hashimoto's, as there have been a large number of questions from many of you around this topic. Therefore, an entire webinar will focus on it. So enough from me, on to you, Jules.
Well, thank you so much, and thank you for inviting me to chat. And I'm actually so excited to connect with you because, you know, I have to say from a practitioner perspective, your platform is so user-friendly. So for me, it's been ideal connecting with patients who have come through the platform because it is, you know, face-to-face and you know, the upload of documents is so easy, and it's, you know, it's really been an absolute pleasure. So thank you, and thank you for inviting me. I think before I go into the talk, I'd just like to draw your attention to the disclaimer. And I want to just note that this information is for educational purposes only. So please, if you want to make any changes, make sure you address those changes with your doctor. So don't just go ahead and do whatever you need. And this information is really not designed to diagnose or treat any medical condition. So as Stacey mentioned, what we're going to look at today is we're going to look at a healthy thyroid function. In other words, what goes on with your thyroid and how should your thyroid be working and what happens when it's not working properly. Now, the thyroid is quite complex and it's very interconnected with so many parts in our body. But there are basically 3 thyroid hormones that we're going to discuss. Thyroxine, which is T4. Now, most people who've got thyroid problems have been put onto something like L-troxin or Euthyrox, and that's T4. And I'm going to address the intricacies of whether T4 is an adequate treatment if you've got thyroid problems. The second one is triiodothyronine, which is T3. And this one is particularly important because the cells in our body can actually only work with T3. They can't work with T4. So as you'll see as I go into this talk, it's very important for your body to be able to convert the T4 to T3. And it's one of the primary problems with hypothyroidism, in other words, under-functioning thyroid, that the body is able to convert this properly. The other one, calcitonin, we're not really going to address tonight. And really, calcitonin just looks at the balance in the calcium in the blood. And I will be addressing reverse T3 because that has a huge impact as well on properly functioning thyroid. Now, the action of thyroid hormones is very far-reaching. So the big one, and these were questions that came up as well, was that the thyroid hormones that increase your metabolic activity. And this is why if you've got hypothyroidism, we struggle to lose weight. We gain weight if we walk past a lettuce leaf and we struggle to lose it. So addressing thyroid is a very good start to addressing weight loss. It promotes normal growth and development. So as a child is developing from in utero, obviously, and as we get older, it's important for that. It's extremely important for the health of our mitochondria. Now, our mitochondria basically are tiny little organelles within every single cell. And they are like the factories that put out our energy. So if we have what I call mitochondrial cytopathies, in other words, our mitochondria are not working properly, then we get a depletion of energy. Now, for those of you who struggle with hypothyroidism, again, one of the very common symptoms is exhaustion. You're just tired all the time. And that's because not only do the thyroid hormones affect our metabolic rate and therefore our energy, but they also affect our mitochondria. So it stimulates our carbohydrate metabolism, which is great because carbohydrates and weight can be very closely associated. It stimulates our fat metabolism, which is even better if we're wanting to lose weight. It increases our heart output. And at this point, I just want to mention certain people are hyperthyroidism. In other words, they have an overactive thyroid. So hyper as opposed to hypo. Hypo is under, hyper is over. And for people who've got hyperthyroidism, they get increased heart output. So they usually get heart rate increases, breathing rate increases, respiration increases, and that's all associated to how and whether or not our thyroid hormones are overactive or underactive. It also increases our gastrointestinal motility. In other words, whether we get constipated. And that's another one of the symptoms of low thyroid function is we get constipated. And in actual fact, women, and I'm not sure, I would say that there are probably majority of women are listening to this webinar, but women often have constipation. And because women tend to suffer more from hypothyroidism than men do, obviously that goes with constipation. And then if you're very constipated, it's disheartening too, because you get on the scale, and from when you got on the scale 2 days ago to when you've gained 2 kilos, and most of it's actually sitting in your gut. It also decreases the transit time. So in other words, how long the food sits in our gut. And it's also a stimulator of all our other endocrine glands, and that includes our sex organs as well. So with a healthy thyroid story, and I will dive deeper into each of these aspects, but as an overview, for our thyroid to be healthy, we need tyrosine. Now, tyrosine is an amino acid, so we take it in the protein that we eat. And I mention this because I do find that vegans, unless they are particularly careful with the vegetable proteins that they're taking in, can drop into a sort of a lower thyroid action story because they're not getting enough tyrosine. A healthy thyroid needs iodine. It's very, very important. And in fact, when you look at the T, the little 4 or the T3, the 4 and the 3 refers to the number of iodine molecules attached to the tyrosine. So T4 is a tyrosine backbone with 4 iodine molecules, and T3 is a tyrosine backbone with 3 iodine molecules. And as I said before, the cells can actually only use T3. So we need to convert the T4 to T3. The third thing it needs is a healthy sodium iodine symporter, because the iodine has to get into the cells in some way. And when we do the next webinar and we go into Hashimoto's, one of the problems with Hashimoto's is the immune system attacks the sodium iodine symporter, and you can't get iodine into the cells as a result, and then of course you don't have effective T3. The thyroid also needs thyroid peroxidase. It's an enzyme, and this particular enzyme actually makes the hormone. So it's very, very important that works in the thyroid. So as I said, we start with T4, and for the body to even make T4, it needs certain vitamins and minerals. And once the T4 has been manufactured, it then is carried on thyroid binding globulin. So just another layer in healthy thyroid. If the body has got too much thyroid binding globulin, it binds up the T4, and the body can only convert free T4. So one also needs not only enough T4, but you also need just the Goldilocks principle, which is enough thyroid binding globulin so that there's not thyroid hormone all over the place, but not too much that it binds up too much T4. And then the T4 converts to the liver. So the thyroid binding globulin will take the T4 to the liver, where it's converted to T3, which the body can use. But what's very important, that in the liver, for the T4 to convert to T3, the body needs selenium. It's selenium dependent. So the deiodinase enzyme needs selenium to actually convert that T4 to T3. And then, as I mentioned, T3 is the active hormone that the cells can use. But what happens is that sometimes, particularly if you're very stressed, the T4, instead of converting to the active T3, it converts to reverse T3. And if it converts to reverse T3, the effect in the body is exactly the opposite. It actually slows down metabolic rate. It slows down your heart rate. It slows down all your energy metabolic processes. So one does need a little bit of reverse T3, but not too much. And when I address stress, which I'm going to, I'll just explain in a little bit more detail why cortisol, for example, so our stress hormone cortisol inhibits the deiodinase enzyme. So it blocks our healthy functioning thyroid. So, signs and symptoms of hypothyroidism. I actually had to cut these down a little bit because there were so many, and I thought, okay, well, I didn't have all the time in the world, but I have highlighted the biggies. And the biggies really are sort of fatigue and low stamina, people feeling tired. And I bet if we did a little straw poll with anybody here who's suffering from hypothyroidism, they would say that fatigue is probably one of the things they struggle with the most. The other thing that is very common is depression. So just not feeling on top form. And it is a clinical depression to some degree, but it might also just be feeling just low key. And that ties in with the fatigue as well. Cold hands and feet, that's very common. But this one I want to mention too, because most women over the age of 50 are more likely to suffer from hypothyroidism. But in actual fact, one of the other triggers for cold hands and feet is also low progesterone. So if I'm dealing with a client and we're looking at the signs and symptoms, cold hands and feet, it can also possibly be low progesterone as well. Now, high unresponsive cholesterol, when you have your cholesterol checked, if you're having your routine medical and you're having your cholesterol checked and your cholesterol is high, it is important to see whether or not your high cholesterol is a primary and high cholesterol itself or is associated with hyperthyroidism, because if it's hyperthyroidism, then you need to address the hyperthyroidism and not the cholesterol, because the two are tied. If you address the hyperthyroidism, the cholesterol will naturally balance itself. And then going straight into treating cholesterol by perhaps going onto a statin is coming in on the end stage and not coming in on the sort of what is the root cause of the problem. Constipation we've mentioned. No eyebrows. This is a great one because, in fact, every single patient that I've seen who's got hyperthyroidism, they start to lose their eyebrows. So eyebrows get a bit thin and the outer third of the eyebrows actually disappears and they've got to start drawing their eyebrows on. Hair is another one, either hair loss or dry, brittle hair. Very, very dry skin that seems to be unresponsive to moisturizing creams. And the other one is brain fog and poor concentration. I actually found when I turned 50, I was calling a lot of things thingamy, that thingamy there in the corner, because the name would just temporarily escape me. And then, I'd wait a beat and then I think, oh yeah, it's a broom or something really simple, but my brain was just not catching up with what I needed to say. And for me as well, I definitely had to address the hyperthyroidism with me, just to boost that a little bit as I crossed the 50 mark. So when you look at low thyroid function, the factors that are associated with low thyroid function are low protein, because you need the tyrosine, vitamin deficiency, so people who are eating a lot of fast foods or are not eating enough vegetables or not eating enough protein or not eating enough of the good fats and are basically eating high processed, nutrient deficient foods, they can very easily click into a low thyroid function. Never mind the other associated conditions that go with it, but low thyroid function, it's, to have a functioning thyroid, you need proper vitamins. The conversion of T4 to T3 is important. The conversion of T4 to reverse T3 plays a role in low thyroid function. We mentioned the thyroid binding globulin. In other words, if you've got too much thyroid binding globulin, that's a problem because you don't have enough free T4 to convert to T3. Associated conditions. So, for example, associated conditions would be high stress or insulin resistance. Now, there's it's so interconnected. I almost describe the body like a web, a spider's web. So if you sort of touch one corner, you get that whole ripple effect through the web. And stress, insulin resistance, belly fat. So often what goes with insulin resistance is belly fat, and what goes with cortisol, high stress is insulin resistance. And in fact, I say to patients as well, if they want to see whether or not they're insulin resistant, just walk towards a wall. If your stomach hits the wall before your nose does, then the chances of you being insulin resistant are actually high. And as you get older, the incidence of insulin resistance gets higher, your stress response gets more problematic, and the impact on that is low thyroid function. Autoimmune attack, and that one we will address in the next webinar because it's really quite complex and I can't really address it in the time that we've got, and any thyroid tumors, and we're not going to address that in this particular lecture as well. That's also a little bit complex. So if you have a look at the cascade, so the cascade from the brain as it trickles down into the cells, where the final result is T3 that the cells can use. What happens is in the brain, the hypothalamus releases a hormone called thyrotropin releasing hormone, so TRH. Now the TRH stimulates the pituitary gland. And somebody did actually ask me what was the association with the pituitary gland in the whole hyperthyroidism process. So the thyrotropin releasing hormone stimulates the pituitary gland, and the pituitary gland releases thyroid stimulating hormone. Now, when you go for a blood test, what happens is that if you say to your doc, I can't lose weight and I'm always cold and I have brain fog, what commonly happens is that your doctor will test your TSH, so that's your thyroid stimulating hormone. And if the TSH is high, then they will assume that you've got low thyroid function. But the problem is, first of all, the parameters. Now, as a functional medicine practitioner, we have much tighter parameters. So if, for example, you go for a test, a Lancet test, and they look at the range of what they consider to be acceptable TSH levels, they will consider anything up to 4.5 as an acceptable TSH level. If my body came back with a TSH of 4.5, I would have a stroke, because 4.5 is way too high. From a functional medicine perspective, we are wanting to address thyroid issues if your TSH is really above 2, but if it's pressing, if it's coming close to the 2, then it's worth having a look to see why. Then what happens is your TSH then stimulates the thyroid gland, which sits here in the throat, to make thyroxine, and thyroxine is T4. The T4 then converts to T3, which is the triiodothyronine, under the ideal conditions, which I'm going to go through now. So again, if you go to your doc and your TSH is high, he will assume your thyroid is not working well, and chances are he'll put you onto something like euthyrox oil or altroxin. Both euthyrox and altroxin are both just T4. But you'll see, as I continue to discuss, that if your body is, for example, selenium deficient, your body cannot convert the T4 to T3. And you can pump T4 through your system, but if the other ideal conditions are not met, in the sense that you don't have selenium, you don't have zinc, you don't have enough vitamin D3, and you don't have enough iodine, your body can't convert the T4. And you will continue with your symptoms despite the fact that you might have sufficient T4. So, as I said before, the T4 and T3 refer to the number of thyroid molecules attached to the tyrosine backbone. And I mentioned that your T4 may also convert to reverse T3. So you may have sufficient T4. You may even have sufficient levels of T3. But if you're very stressed or you've got some low-grade infection, I'll go through those with you now, then your body may be converting your T4 to too much reverse T3, and reverse T3 blocks the effect of T3 in the cells. So for an effective conversion of T4 to T3, the body needs selenium, as I mentioned. It needs chromium, zinc, vitamin Bs, so vitamin B2, 6, and 12, vitamin A, iodine, as I mentioned, iron, and copper. So these are all really, really important for that effective conversion. Plus, because most of the conversion takes place in the liver, one needs a healthy, non-fatty liver so that effective conversion can take place. So if you are struggling and perhaps you've gone on to T4 and you're not getting a good response, one needs to test T3 and you need to test the liver to see what's going on in the liver. And in actual fact, there's a condition that's coming up. This is just a little aside, but there's a condition that's coming up more and more, and it's called non-alcoholic fatty liver disease. And really what happens in this, it's got to do with a gene SNP, basically a gene combination that many people have got. And what happens with this, it forms fatty pockets in the liver. And if you've got a lot of fatty pockets in the liver, then it looks like you're a heavy drinker. So it looks like you've got cirrhosis of the liver, but in actual fact, you don't. You might never have touched alcohol in your life, but you've got this particular gene SNP. So if you're doing medicals, or you're doing a once a year or once every 2 year servicing, and I say to my patients, we service our cars once a year, but we're lucky if we service our bodies every 5 years. So I normally recommend that there's certain baseline tests that you can look at, and they're not hectically expensive, that are extremely telling to see where the body is in terms of general health, and looking at the GGT in the liver. I don't always test the ALT and the AST, but the GGT definitely in the liver. I have a look at that, and I always look at TSH, free T4, and free T3, because thyroid health impacts on so many other metabolic processes, including your risks of Alzheimer's in actual fact. So you also need a healthy gut and good gut bacteria, because there's a degree of conversion that happens in the gut as well. And the effective conversion is inhibited, so it's blocked by aging, which unfortunately we can't escape from. Stress, I've mentioned. If you're overweight or you've got insulin resistance, effective conversion is blocked by that. Heavy metals, so if you've got mercury fillings, that is a block for effective thyroid function. Radiation, POPs, so persistent organic pollutants. And now, so if you are farmers, for example, we always think farming life is so healthy, but with all the pesticides that they spray on the fields, they often have health problems. So at this point, just make sure that you wash your food really well. And there's actually a little website that you can go on to called The Dirty Dozen. And The Dirty Dozen lists the 12 particularly bad foodstuffs for persistent organic pollutants, so pesticides. If you've got kidney and liver disease, if you smoke, if your alcohol intake is too high, diabetes and insulin resistance, extended fasting. Now, I know intermittent fasting has become very popular, and I love intermittent fasting. But when I'm dealing with women, sometimes because our bodies are designed to carry babies, even if we are over 50s and that option is now gone, please let it stay gone, and we do a lot of fasting, it actually does slow the thyroid function a little bit. So there is a happy medium when you are addressing intermittent fasting. So what is going to be great from a fasting perspective, but isn't going to affect the health of the thyroid at the same time. Hormone imbalances, hormone replacement therapy. So if you're on HRT, if you are on the contraceptive pill, all of these affect a healthy thyroid. And obviously the really challenging ones like chemotherapy. So I'm sorry, this diagram actually, it's a bit fuzzy. I wanted it to come out, a little bit better, but you can still sort of see what's going on. So there's your little thyroid where your T4 is made, and your thyroid, your T4 is going to convert preferably down this pathway to T3. And the factors that increase the conversion from T4 to T3, selenium is a biggie, zinc is another one, vitamin A as well. Or what's going to happen, it could convert down this pathway, which is the reverse T3 pathway. And what triggers a conversion down the reverse T3 pathway? Stress, trauma, a low-calorie diet, systemic inflammation. Now, what can sometimes happen with systemic inflammation, and this again is very common in autoimmune conditions like Hashimoto's. You may have a low-grade inflammation because you are sensitive to foodstuffs like gluten and dairy. You may not be allergic to it. In other words, you may not be a celiac and be sort of aggressively allergic to gluten, but you may have this low-grade sensitivity that causes an inflammation. And when you have a low-grade inflammation, your thyroid is not going to function properly because you're going to convert too much T4 to reverse T3. Liver and kidney dysfunction I've mentioned, and certain medications. So if you go on any medications, just always read the package insert. Always cross-check what anybody tells you, because, it's your body. And we have to take responsibility for what goes on in our body. Because, if you go and you chat to your doc, their time frame that they have with you is maybe 15 minutes. They really, really don't have the time. And especially now with, the very heavy health demands that the medical profession is having to deal with at the moment. So they don't have a lot of time to explain all the permutations around whatever medication that they're putting you on. So it's always worth having a little look for yourself. And then the factors that improve the cellular sensitivity to T3, which are the thyroid hormones, vitamin A we mentioned, exercise is fantastic, and of course we have already mentioned zinc. Now the conversion to reverse T3, now unlike the conversion to T3, the conversion to reverse T3 is not selenium dependent. So what happens is that if you do not take in enough selenium in your diet, the body will preferentially take the T4 and push it down the reverse T3 pathway because it just doesn't have enough selenium. And selenium is actually very, very easy. If you've got time right at the end, I think I have put in a slide that we can just go through the foodstuffs that are high in selenium. But Brazil nuts, if you just have 2 Brazil nuts a day, you'll get enough selenium. Now, stress, trauma, low-calorie diet, inflammation, we've discussed all of those that block the conversion to T3 and will promote the conversion to reverse T3. Causes of hypothyroidism, so causes of low thyroid function, and this is excluding the Hashimoto's. So our age, so over 50 and especially women. Men somehow seem to escape this. In fact, men escape a lot of problems that women seem to have to deal with. Low nutrients, again, if our diet is very processed. Low iron. Now, when you are younger and you still have your cycles, you still got your periods. If you have very heavy periods, one of the blood tests that's really, really worth having done is having a ferritin, because iron is a player in so many healthy functions that to have too little iron affects the health of your thyroid. But the other thing is, as we get older, if you're into the 50s and the 60s and the 70s mark, because we're no longer having periods and our body's not clearing iron, the iron levels can build up. And if you, for example, you need your iron levels to be between 90 and 110. If they're over 400, you've got way too much iron, and iron is extremely inflammatory. So if we kick back to that web where you just touch one corner, it ripples through the whole web. If high inflammation causes poor conversion and you've got high iron and therefore you've got high inflammation, it's going to affect the efficacy of the conversion from T4 to T3. So when you're addressing a thyroid problem, you can't just look at TSH and go on to a T4. You have to address all of these factors as they come up to see what is the root cause that's causing that low thyroid function. Acute stress, so in other words, a death in the family. I think with COVID at the moment, I think we're all suffering from post-traumatic stress disorder because our lives are turned upside down. And this acute stress that we're going through because of perhaps job situations or dealing with children at home or all of these factors that we've had to take on board, even a year from acute stress, it can impact the effect on the thyroid. So once things have started calming down, I would suggest that all of us, we do some baseline body servicing to see where do we stand now and what needs to be addressed so that the effects don't accumulate until they're so bad that it becomes a problem, and addressing it is more problematic than it can be. So autoimmune reaction, so either Hashimoto's or Graves. Hashimoto's responds in the body with hypothyroidism. In other words, it reduces the thyroid effects. Graves does the opposite. So they're both autoimmune diseases, but they have a slightly different effect in the body. We will address those maybe in a month or 2 months. I'm not quite sure. Jess and Stacey will tell me when. Heavy metal toxicity, increased thyroid binding globulin. So as I said, your hormone replacement therapy, and so what happens as we cross the 50 mark and we go into menopause, if we are on hormone replacement therapy, it might be great for the hot flushes, but it's not so great for the thyroid. So we need to create some sort of a balance there. oral contraceptives if we're young and we are of childbearing years, long-term ineffective thyroid replacement, and this is where I would say T4 has not always been a service to us. Because if we go into T4 and we stay on T4 because, well, it's a very cheap allopathic med for one thing, but, you know, we put onto it because it might not be that, you know, the TSH stays high. What happens is that after a while, our thyroid actually thinks, oh, well, you know what, it's getting it from an external source. It doesn't actually need to do the work itself. So it's always worth creating a situation in the body where the body has to work for what the end result is going to be. And that's why when you look at functional medicine, so functional medicine basically, it's a more holistic view as opposed to a reductionist view. We look at all the aspects that may predispose towards will vary, whatever the condition happens to be, in other words. So we're looking at what is the root cause rather than just addressing the symptom on the other side. Increased stress and decreased sleep. Sleep is a primary for general health. All right, treatment, get tested. Now, for those of you who are wanting after this talk to get tested, if you want to do it through your doc, please request a T3. So you want to request a TSH, a T4, and a T3. They don't routinely test T3. Even if you have to pay for it yourself, it's probably about 300 or maybe 400 Rand. It is so worth doing because just looking at the TSH or just looking at the T4 is useless if your body's not converting properly. You want to also address low gastric acid because as we get older, our gastric acid levels start to drop off. And when they drop off, even if you're eating an organic diet or a diet that's very high in vegetables and salads, which is fantastic, but if we're not digesting it properly, our body can't extract all the right nutrients from the food that we're eating. Or if we're on supplements and we think we're doing the right thing, but our body's not extracting the right amount. So low gastric acid is important. And there are signs and symptoms of low gastric acid. In fact, one of the questions was a lady said she was getting rosacea. In other words, it's almost like adult acne or very, very pink cheeks. That is a sign of low gastric acid. So if you've got that, you do need to address that. You want to increase the heme iron in the diet. Now, heme iron, unfortunately, comes from meat. And it is challenging for vegans because, first of all, it's important that vegans get enough tyrosine so that they can make their thyroid hormones. But also, the iron that comes from plants, so non-heme iron, isn't as effective in the body as heme iron. You know, at the end of the day, one needs to work with the lifestyle that you want to create. So we need to work around that. But it's just helpful if one is okay about heme iron. If you're going to add an iron supplement, please don't just add an iron supplement. So if you're tired, test your ferritin because you may be tired for other reasons and not because you're low in iron. And if you just go onto an iron supplement and you are already high in iron, your inflammatory process is going to go up. If your inflammatory process goes up, then you get a cascade of problems. And remember, a lot of our chronic diseases are rooted in inflammation. So stroke, heart disease, even the cancers are rooted in inflammation. So you want to keep your body cool. You don't want to add things that are going to increase inflammation in your body. You need to add other supportive nutrients, in other words, the vitamin A, zinc, the selenium, vitamin D, and iodine. Be very careful of iodine because if you are struggling with Hashimoto's, even if it's undiagnosed, and you add iodine, iodine can trigger that Hashimoto's to be overreactive because it accelerates the antibodies that attack those hormones. So one has to be very, very gentle with iodine. Unfortunately, in South Africa, it's not so easy to test iodine. You know, in America, you can test all these things. In South Africa, you know, if I have a patient that's really challenging, sometimes you do need to see the iodine in the urine. So you basically collect the urine for 24 hours. You can imagine what a hassle that is. And you test to see how much iodine there is in the urine. But where possible, one can make educated guesses and you can work around that and add enough iodine, but not enough to trigger into any kind of a problem with the Hashimoto's. You want to remove or manage your stress and your stresses, and please try and get a good night's sleep if you can. I know that's easier said than done, especially when you hit the menopause sort of age range, because all of a sudden you cross the 15 mark and sleep that used to be so wonderful is a luxury. But managing it as best you can will impact very positively on thyroid health. You need to check homocysteine. And I'm not going to go into this because it's really complex. But homocysteine is a marker for methylation. And one can test in gene tests, but if you look at homocysteine, it's a little bit of a cheat to see whether the body is methylating properly. And I'll save that for maybe another lecture. Maybe I'll go into methylation in another lecture. So a good start is to start by detoxing the body. And by detoxing the body, I don't mean go straight into a grape detox or a water detox. There's a way to detox the body that stimulates the liver to detox gently and slowly without dumping all the toxins in the blood, overloading the liver and making the whole problem worse before you even start. Important test values. So just take note of these, because if you go to your doctor, these are very important, and these are the values that you need to look at. So for ferritin, which looks at your iron, you want it to be between 70 and 110. Your vitamin D, you want it to be between 50 and 80, because even though we live in sunny South Africa, often we go straight from our houses to our cars to our offices. In this day and age now, we're in our houses all the time. We don't get out in the sun. So our vitamin D levels, I mean, I've seen patients' vitamin D levels are below 10, so, and vitamin D, certainly from our immune function perspective, never mind our thyroid, it's very, very good to get your vitamin D levels up. Your TSH, you want it between 1 and 2. If it's above 4, you're going to suspect Hashimoto's. Even though when the lab tests come back from Lancet, it may say it's euthyroid. In other words, they consider your thyroid to be healthy if it's 4. I don't consider it to be healthy at all. Your T4, it depends on your unit of measurement. Generally in South Africa, you're looking at the P moles per liter, so between 15 and 19. Always on the upper margin is better than on the lower margin. T3, optimal, if you look at the PG per milliliter, you want it to be round, or the P moles, you want it to be round about 5. So between 4.5 and 5, that's a good level to be at enough for your cells to use. Your TPO, below 10, all your antibody testing, you want those antibody testing to be low. You don't necessarily need to test your hemoglobin or sodium unless you're just not getting results. Your GGT, so that's your liver function, you want that to be between 10 and 30. I like it to be round about the 15, under the 20 mark, because then your liver's not overloaded at all. And if you want a quick and lively test, just take your temperature every morning, and you want your temperature to be round about 37. Below that, if it's consistently cool, then chances are you are a little bit hypothyroid. Signs of low iodine, a goiter. So in other words, the swelling in the front of your throat here. If you tip your head back and you've got a bit of a goiter, you'll see the swelling, or you can feel it. Or when you swallow, you can just feel that it feels a little bit difficult to swallow. Ideally, if you go to a practitioner, they should check to see that your thyroid doesn't have any nodules and it's not swollen at all. One of the other questions was, are the nodules harmful? Look, it really depends. The nodules are a sign that your thyroid is struggling. So if you do feel and you think, oh, what's that? It is worth having your thyroid levels checked to see whether or not your thyroid is functioning properly. If your cholesterol is elevated, that's a sign of hypothyroidism and low iodine. I want to just talk about the halides now. Just one thing. If you're eating iodine-rich foods or you're adding iodine, so you're adding something like Lugol solution, which you can get it's a tincture really that you can rub on your skin. You never add iodine without selenium. So you need to saturate your body first with selenium and then add any iodine. So just quickly talking about the halides. On the periodic table, for those who know something about the periodic table, there's a category called halides, and iodine is a halide. And basically chloride, bromide, fluoride, and iodine or iodide, they're all halides, and they sit underneath each other. They sit one on top of the other in the periodic table. Now, bromide and chloride and fluoride, what they do is that if your body has too much of any of those, they knock out iodine. So they're similar in their molecular makeup to the iodine molecule, and they sit on the receptor site and they block the receptor site from iodine. So of course, when you think about it, we've got chlorinated water, we've got fluoride in our toothpaste, plus fluoride is, when you go to the dentist, what do? They give you a fluoride treatment. Our water's fluoridated. Antibiotics, a lot of the antibiotics like Ciprobay, for example, has got a fluoride component to it. Prozac is fluoxetine, so again it's got a fluoride component to it. So if you're on any of these, you've got the halide component coming into your body, and it's going to knock out the iodine. So if you're on those and you're struggling with thyroid problem, it could possibly be because the fluoride is knocking out the iodine, and then you need to saturate then with a bit more iodine. Bromine. So bromine, it's okay. We don't have it here. What is this thing in Mountain Dew? Mountain Dew is just absolute poison. But the juices like the Powerades and the orange Fantas and those orangey type juices are saturated with bromine, and bromine of course is a halide, so it'll knock out your iodine. So related conditions I mentioned, diabetes, insulin resistance, all of these can cause the subclinical hypothyroidism. So it may not be overt, but you just don't feel great. You go back to those signs and symptoms and you think, oh, I've got a lot of those signs and symptoms. And if you're obese or you've got metabolic syndrome, any cardiovascular diseases, suppressed pituitary function, they all have a knock-on effect to the health of your thyroid. The first thing to do is address your stress. So if you're going to make one change, aside from being tested, address your stress. And I know this is easier said than done, because sometimes the stress just won't go away. And if the stress won't go away, then you need to address how you manage the stress. And because cortisol, which is our stress hormone, inhibits the 5-deiodinase enzyme. So in other words, that's the enzyme that converts the T4 to T3. If you're stressed, you don't get a good conversion. And if you're stressed, you're going to get a greater conversion to reverse T3 rather than the T3 that the cells can actually use. So getting enough sleep is very, very important. I actually think such a large part of my practice is addressing sleep. So addressing menopausal symptoms, of which poor sleep is one of them. And again, if you can make one change, try and address your sleep patterns. You need to remove food sensitivities. So often gluten and dairy are, they are biggies in causing an impact, either with systemic stress or with hyperthyroidism. You need to manage your blood sugar. You need to address your gut dysbiosis. So go on to good gut bugs, good probiotics. The best way of going on to probiotics is actually, in fact, not to take a probiotic supplement, because you don't want a preponderance of any particular species of probiotic. A great way is to get a SCOBY. It looks like it's a rather little weird looking plant. So you get a SCOBY and you make your own probiotics, because it's cheap and you get a very wide range of probiotics. So that's great for gut health. But just on that, I want to mention certain people don't break down histamine. They've got a gene SNP called DAO, and DAO blocks the conversion or blocks the breakdown of histamine. And probiotics are very high in histamine. So if you take probiotics and you find you're getting sinus problems or flu-like symptoms, you may have a problem with the DAO. You need to balance your hormones, particularly progesterone, because progesterone, actually, nature's wonderful. Progesterone, Jess will tell you, I love progesterone. Progesterone is a hormone that is very calming. So when you're stressed and you're not sleeping, if one measures progesterone, because to make changes without measuring first, I think is a little bit foolhardy. It really does help one feel so much better about oneself. You need to consider viral infections like Guillain-Barré or what are the other ones? Their names just escape me for the moment, but low-grade viral infections, and as I said, to detox, to remove any toxins. Recognizing stress, we know when we're stressed, we have general fatigue. That mid-afternoon slump is a big one. You have a good night's sleep and you wake up in the morning and you feel like you haven't slept at all. Headaches and migraines. You have anger outbursts, road rage. That's a stress response, a low-grade stress response. Food cravings, certain things, like blurred vision, that can be not related to your eyes. It can just be related to stress. Hangry, so you get very angry when you're hungry. I get this. You ruminate a lot. So you lie in your bed and your mind just goes round and round and round and round. That is also a stress response. And then orthostatic hypotension. So when you get up suddenly, and especially out of a hot bath, and you feel faint, that is a stress response as well. The overactive thyroid, I'm not going to address it in this one, but I mentioned increased heart rate, palpitations, anxiety, feeling wired, clammy skin, excessive weight loss, hair loss, trembling. These are all signs of hyperthyroidism, which in the next one, when I do Hashimoto's, I'm going to address Graves as well. We'll go through that in a couple of months. So just to conclude, I don't know how long I've taken here, but so thyroid malfunction affects our risk of, never mind the fact that we gain weight and we can't lose weight, that's demoralizing. But it increases our risks of heart disease. So when our thyroid is not functioning well, we have increased risk of heart disease. We have increased risk of metabolic syndrome, increased risk of obesity, of course. We need to do a full thyroid panel. When you go to your doc, you need to request a full thyroid panel, or you can come to me, and when we address your thyroid, we will look at it right from root cause. Thyroid health also plays a role in mental acuity and risk of Alzheimer's. So one of the things too, if you've got elderly parents and they are showing signs of dementia or showing signs of being extremely brain foggy, you need to look at thyroid, because it might not be dementia. It might be thyroid, or it might be vitamin B12 in actual fact, because that's a big one. Because as you get old, your gastric juices are almost non-functioning, so you don't absorb the vitamin Bs, particularly vitamin B12, well actually all the vitamin Bs. And vitamin B12 has the same, let me just recap, sorry. Deficiency in vitamin B12 has the same effect as early Alzheimer's in actual fact. To go back to vegans really do need to go on to vitamin B12, because this vitamin B12 comes in animal products. And the other thing I would suggest that you test regularly. So you just do baseline. I would say on average, if you did a baseline test, and I generally split it up. So 1 year I'll do half, and the next year I'll do the other half. You're looking at around about 2,000. And, it's for longevity and for vibrancy and vitality and avoiding chronic diseases, to put aside a little amount every single month and spend that money on getting your baselines done is so worth it. So some of the questions I'm just going to go through now, because these were questions that people sent at the beginning. And then if anybody's got, I suppose we'll open up the floor then, Jess and Stacey, but let me go through these ones first. So the question of how does functional medicine differ from allopathic medicine? So allopathic medicine is really separatist, or it's reductionist. In other words, what they do is they look at each organ in your body as a separate entity. And each part of the body is addressed separately. So, for example, let's say you've got Hashimoto's and it's an autoimmune condition. You will go to an endocrinologist who will address your thyroid specifically, and not necessarily the autoimmune condition that may have a cascade throughout the whole body. Functional medicine is more holistic. So what we do is we look at root cause and we address what was the trigger for your particular condition. So for example, if you go, let's say you're overweight, you've got depression, you're getting very bad headaches, and let's say you are cold all the time. If you go to your doc will maybe put you onto an appetite suppressant, or he may address your insulin and put you onto something like glucophage. He may give you painkillers or migraine things for your migraine. He may put you onto Prozac or antidepressant for the depression. So he addresses each of your conditions separately. Whereas it might have its root, I need my orthopedic lip gloss here, sorry about that. It might have its root cause in low-grade inflammation or an autoimmune condition. So if you address the root cause, you get this wonderful domino effect where you just feel better because you're addressing the root cause. So that would basically be the difference between functional medicine and allopathic medicine. Functional medicine is science-based. The downside to functional medicine is you have to do the work yourself. So we find out what is the root cause. As a functional medicine practitioner, I will give you all the tools that you need to address that root cause, but you have to go away and do it. And it's not a matter of saying, here, take this pill, but otherwise you can live the rest of your life exactly as you've been doing. Mostly I will make lifestyle changes that will, look, the impact is fantastic, but it does mean some changes that are sometimes not so easy to do. One of the other questions was, is low thyroid function lifelong? No, but it really depends on the cause. So for example, if you've got low thyroid function and your low thyroid function is due to the fact that you're very stressed and you've got cortisol pumping out your body and they're addressing the thyroid and they're not addressing the stress, you're going to have a problem with low thyroid function for the rest of your life if you don't address the root cause. So it really depends on what is causing the low thyroid function in the first place and whether or not one can address that as a root cause. Can you address thyroid naturally? I believe the body should always try and do the work first. So I will always address it from a natural perspective first, and only once we've traveled down that road a little bit will I then look at addressing thyroid, something with natural desiccated thyroid, or a combination of T4 and T3 or either or. So push the body down the natural path first, see how you do on that, and then only if it's gone beyond that do we look in a little bit more detail on what else is out there as far as treatment is concerned. Cost of functional medicine. So functional medicine is perceived as being very expensive, and it can be very expensive because depending on the functional medicine practitioner and how important it is for them to really dive into root causes. Sometimes diving into those root causes involves tests that are very expensive. And it's partly due to be living in South Africa because some of the tests are just not done here. We have to send them to Doctor's Data, or we send them to America or to Britain to have the tests done. I try not to do those tests. If at all possible, I'll do the baselines and we address the baselines. So you can travel a long way down the road where we can change so much and get fantastic benefits without doing the very, very expensive tests. But it depends on how resistant you are to whatever the changes are and how much damage has been done to the cells to start with, whether or not the more natural approach is going to work for you. Why is weight loss more difficult? Mainly because the thyroid affects your metabolism. And of course, we know if you've got a sluggish metabolism, not only are you not going to lose weight, but you're going to gain weight if you walk past the lettuce leaf, as I said. So weight loss is difficult. But the other thing is that I mentioned stress and cortisol. So cortisol, if you're stressed, the body tries to prepare for the stress event. So what it will do, the body can't tell the difference between running away from a saber-toothed tiger and dealing with an aggressive boss every single day. So if you're chronically stressed, the body's pulling cortisol from the muscles, and cortisol is almost a sugar. It almost works like a sugar. So cortisol pulls from the muscles the stored sugar. And when the cortisol pulls the stored sugar from the muscles, it does this because it's not sure whether the body is going to have to run away or it's going to have to turn and fight. So now you've got the sugar in the blood, so you've got an energy source in the blood. But what happens with the energy source is insulin goes up. And if insulin is going up all the time, then you can be insulin resistant. And then if you're insulin resistant, you're going to have belly fat, so your weight loss is going to be more difficult. So again, you're looking at what is the root cause, and you're addressing the root cause rather than trying to just address the thyroid. Altoxin versus natural thyroid support. So altoxin is just T4. I don't think just T4 is sufficient to treat hypothyroidism adequately. But sometimes if you've been on altoxin throughout for many, many, many years, you don't go off the altoxin. We just try and create a situation where your body can use that altoxin, the T4, convert it to T3 so the body can actually use that T3 in the cells. Important foods, I think I've got a slide for that a little bit later on, and then we'll do any other questions if time allows. So just let's have a look. Okay, selenium. I want to just touch on selenium a little bit. So if you're going on to a selenium supplement, don't exceed 400 micrograms per day. And you shouldn't go on to selenium indefinitely, because selenium in high doses is also toxic. So it is one of those things where you just want the Goldilocks principle. You want enough so that your body can convert the T4 to T3, but not so much that it's going to become toxic. So if you're very selenium depleted, you can do 400 micrograms daily for a couple of months, and then you want to back off. So if you're going to make changes with your thyroid, you need to test, you need to make the changes, and then you need to test again to see what's happening in your body. The other thing that's very interesting is selenium is not only fantastic for thyroid, but it has an affinity for mercury. So selenium binds mercury. Now, it's a double-edged sword, because if you've got mercury poisoning, it's fantastic for sequestering the mercury. But if selenium sequestering the mercury away from your organs, it's also so busy sequestering the mercury that there isn't enough selenium left over for your thyroid. So you get that double-edged sword. Okay, so selenium-rich foods, Brazil nuts. So you need, if you're looking at 90 micrograms per large nut, you need maybe 3 to supply you with enough. And it's always better to take your supplements or to take your nutrients in the form of food. So if you just have a look at these, organ meats has got about 70 micrograms. I have to say here, if you don't like organ meats, it's a pity, because liver, those type of organ meats are so healthy. They really are fantastic, because they're very high in vitamin Bs and they're very high in selenium. And, these are all vitamins that the body just loves and needs so much. Pork and beef I've got, but not so much. And you can see chicken, it's got, about 40 micrograms. So you really need to eat quite a bit of those. Foods containing iodine. So all your seaweed type foods that go with your sushi. Remember with sushi though, that sushi is very high in mercury. So, if you love sushi and you love that nori that sushi's wrapped in, then just watch out for the mercury that comes with it. And so all the seafoods, and you can see dairy a little bit, cottage cheese has got, eggs. So these are all things that you can add. Blackstrap molasses is quite high in iodine. So to add these foods, if you don't already have them, just so that you can supplement your iodine intake a little bit. And I think that is me. We can open up the floor now.
Amazing. Thanks so much, Jules.
I don't know how much time I took there, Jess. How much was it?
No, you're good. You're an hour.
Perfect.
Your knowledge always astounds me. Yeah, we'll just see if anybody has any questions. No, lots to digest, I think.
Okay, fantastic. If anybody does think of questions a little bit later and they want to, contact me if they've got, things that they've just thought of sometime down in the still watches of the night, they're welcome to do that.
Yeah, awesome. Thanks, Jules. And I've had my own little walk with Jules, and yeah, she really has an amazing way of creating this safe space and just making you feel so understood. And you walk out, sometimes you can leave a doctor's room and go, so what's actually wrong with me? Like, what do I actually do now? And you feel a little bit lost, but she has a great way of leaving you feel really equipped with a roadmap to, reach those health goals, or just to feel generally healthier and better. So if If you are looking to see Jules, you are more than welcome to on Connectable Life. We do also have a little surprise to give away, which is a consult with Jules.
Yes.
So we did a random selection, and the lucky winner is Bernita. So Bernita, we will get in touch with you. But yeah, Jules, again, thank you so much. I know it takes a lot of time and energy and effort to put these things together, so we really appreciate it. And sure, offering us your 25 years of knowledge, really great. So thank you so much, and thank you to everybody else that has joined us. Yeah, we know how valuable everybody's time is, especially in these evening slots. So thank you all so much, and yeah, we hope to chat with you all soon.
Wonderful. Thank you so much. I loved it.